part, which is the brachium part. So here you have the spine of the scapula, and above the spine of the scapula is the supraspinatus muscle. Below the spine of the scapula is the infraspinatus muscle. Here you have the teres minor, and here you have the teres major muscle. In between the teres minor and teres major muscle is the triangular space. The artery that goes through the triangular space is the circumflex scapular artery. Okay. When you turn the here, you have the subscapular fossa of the scapula, and the muscle that lies on the subscapular fossa is the subscapular muscle. Here you have a nerve that innervates the subscapular muscle, and this nerve is called the subscapularis nerve. If you can see here, you have a scapular foramen, and this one here is the superior transverse ligament. Below the superior transverse ligament is the suprascapular nerve. Above the transverse ligament is the arteries and veins. Those are the blood vessels that supply blood. Below the clavicle is the subclavius muscle. Sub means below and clavius means clavicle. What else? So if you flip it to here, you have the deltoid muscle. This is the deltoid muscle. If we remove the deltoid muscle here, you can see that the deltoid muscle is innervated by the axillary nerve. And this is the posterior circumflex humeral artery. And the axillary nerve and posterior circumflex humeral artery goes into a space called the quadrangular space. This is the triceps. This is the long head of the triceps. This is the lateral head of the triceps. And this is the medial head of the triceps. All of these form tendon, which is the shiny part here. And if you open this, you can see that there is the radial nerve. Radial nerve passes through, and the deep brachial artery or profundum brachial artery passes through this interval, which is called the triangular interval. So the radial nerve and the deep brachial artery passes through the triangular interval. This is the olecrayon. Then if we flip this like so, we're going to talk about the forearm now. So, the forearm is composed of anterior compartment and posterior compartment. The anterior compartment and posterior compartment is separated by the intermuscular septa and also fascia and bones. So, we'll start with the superficial layer. This here is on the medial side. So you can look from the little finger, and this is the medial side. And if you go all the way here, this is the flexor carpi ulnaris. Flexor carpi ulnaris means flexion of the wrist, carpi which is wrist, on the medial side. Okay. And if you go here, one second. This here is the flexor digitorum superficialis muscle. Turn it here. This is on the lateral side. It is the flexor carpi radialis muscle, flexion of the wrist on the radial side. And below the flexor superficial muscle, you have the flexor profundus muscle. Is that right? Flexor profundus muscle. Okay? No, flexor digitorum profundus. Flexor. Okay, one second. So all messed up. Flexor digitorum profundus muscle. And below the flexor digitorum profundus muscle is this shiny part, which is the pronator quadratus muscle. Okay? So let's turn it to the lateral side. Okay? So here is the, oh God, it's all messed up. Here is the flexor carpi radialis muscle. Next to it, you have the brachioradialis muscle. And next to that, you have the extensor carpi radialis longus. And then next to that, you have the extensor flexi, no, that's not right. Extensor carpi radialis brevis. So, okay, sorry, let's repeat that again. Flexor carpi radialis, brachioradialis muscle, extensor carpi radialis longus, extensor carpi radialis brevis is here. Okay? Okay. So, you have a connective sheet called the flexor retinaculum that makes up the carpal tunnel. So this sheet, the space between the carpal bones and the flexor retinaculum makes the carpal tunnel, which is here. You also have the radial tunnel and ulnar tunnel, which is here. Okay? Carpal tunnel, radial tunnel, ulnar tunnel. And in which goes here is the median nerve. Where is the median nerve? And this is the, I think this is the median nerve, I think. I'm not sure though. Okay, let's start from here. This is the ulnar nerve. You can recognize this is the ulnar nerve because it passes through here. Okay, this is the ulnar nerve. Ulnar nerve, and then if you go here, this is the ulnar nerve. Oh my God, it's so everywhere. Common interests. Okay.
This one broken.
Yeah, this one, right? It's broken, no wonder. Okay. So, Arshia Sakia broke this because she pulled it very weakly. So this is kind of her fault. So this one is what Arshia Sakia broke. This is, do you see this one?
Yeah.
This is the brachial artery. So first you have the subclavian artery, then it goes to axillary, and then you get brachial artery. And the brachial artery splits into the two branches, ulnar and radial. Ulnar artery and radial artery. Now the ulnar artery splits into two, into the common interosseous muscle, which splits into anterior and posterior division. The end. Okay, let's go.